Good morning, Sawadee Krap. I'm speaking to you from Pattaya, my house here, and unfortunately I've come to a point here in Pattaya that I've got to go in for some major dental treatment. Now, I have to admit that since a small lad actually, quite a few years ago as you can see, I've had an inherent fear of dentists. And that hasn't eased off at all over the years. So I've realized for some time that I've got a dental problem, and one by one I've been losing teeth, particularly on the upper part of my mouth here. And last year actually I started the plan of getting maybe dentures for the upper part of my mouth. The problem is I've still got 7 teeth in the top, and they have to come out. And one of those teeth only came through about 5 years ago. It had been kept in place by the existing teeth, and when they came out, then it actually managed to make its way out. But it came out at a funny angle. And the first clinic I went to, they said, well, you'll have to have this dealt with in a hospital because they don't feel confident of taking that tooth out because it may require surgery. And as it transpired, they were unable to take an x-ray to establish it, so they suggested I go and see a hospital. I also established, because I was asking if I could get a general anesthetic to remove to have the teeth extractions done, and they tell me that that's only possible in hospitals also. So, 2 reasons why I had to go and visit the hospital. One, to have that tooth looked at, and secondly, if I wanted to have it done in general anaesthetic. Now, just for a moment, I'll go off at a tangent about Thai dentists. I've been associated with Thailand for some years, and I have, until I retired, I've been travelling back and forward to UK and Europe, and I did go and have dental treatment in UK several times. And with one dentist, it was a young lady I was talking to while she was giving me treatment, she was telling me about her experience, because she'd been to Thailand and she hadn't been qualified as a dentist for too many years. And she told me some interesting facts that while she was here in Thailand on holiday, she had actually done some research on dentistry and met up with some dentists here. And it transpired that for people to get a dental qualification here in Thailand is actually takes a bit longer than it does for UK dentists. The reason being, she told me, was that they have to have a higher degree of medical qualification before they can get their dentistry qualification. So that was quite interesting. Now, I'm not saying that Thai dentists are better than UK dentists, or vice versa. All I'm trying to make the point there is that Thai dentists are well trained, and when you visit the clinics, etc. here, you can see they're immaculate. They've got all the modern equipment, most of them have anyway, and they've got some very nice facilities all round. I did have one bad experience about 4 years ago with a dental clinic here in Pattaya, when I needed an extraction again, and I went to this dental clinic, which was a very small place, nowhere near as plush as some I've seen since, and it was a young man that was doing the dentistry. Now, when I went in, I was closely followed by 2 other patients, and my wife came with me. Now, I was taken in first. Now, obviously there was a bit of pressure on the dentist then, because you had suddenly got 3 people in the waiting room, all wanting dentistry, so it was an opportunity for him to make some money. Well, establishing that the tooth did have to come out, he gave me the necessary local anaesthetic, and then within about 2 minutes he had the tools on my tooth and started pulling away, and it was agony, and I screamed, and then he gave me another anaesthetic, and then immediately started pulling again, and oh no. Anyway, this went on for a little while till eventually the anaesthetic did kick in, and he managed to yank this tooth out. But by that time, the other two patients that were sitting in the waiting room outside had heard all this commotion and screaming and me yelling, and they had decided to go somewhere else. When I came out, the waiting room was, apart from my wife, was empty. Anyway, that was that story. So, not all goes that well. So coming back to the present, last year, August last year, I went to one of the hospitals. Now there's several choices for dental treatment in hospitals. We've got a very, very good one not far from here, called the Bangkok, Pattaya Bangkok Hospital. Now this is a private hospital, very, very well established, got all the most modern equipment, well regarded, but very, very, very expensive for anything that's done. So I knew that, and I'd heard that some of the private hospitals outside Pattaya were actually substantially less expensive. So I thought I'd have a look at those. Now let me just go off at a tangent again for a moment. Before that, I was having dental treatment done here, and I was having it done at a government-run hospital, which is for Thai people, obviously, and not a private hospital. But expats like myself are welcome to use the facility. And I had gone down there, and I've had 2 extractions done down there, steadily losing my teeth. But I was very, very impressed there by the way that they operated and the effectiveness of the treatment and the pain-free extractions that they gave me. And I'd hoped that I'd get this other treatment that's now coming up. I was hoping to get that done there. Well, when I noticed this hole appearing in my tooth several weeks ago, I went down there, and the problem with the government-run hospitals is you've got to be there at 7 o'clock in the morning. There's no booking system. You take your turn in the queue, and you can be sitting there for quite a few hours before you're seen. Now then, you've also got to have your blood pressure taken, etc., before you go in, your height and your weight and blah blah blah, to check that you're medically fit to go into the dentist. So I done that, and then I went through all the registration, etc., etc., and then I got to the dental reception, and the lady said to me, "Okay, what have you come here for?" Now the waiting room was already quite busy, but I was the only expat in the vicinity that I saw, and I said, "Well, I've got a hole in a tooth, and I need to get it filled, I hope." And she said, "Well, are you having any pain?" I said, "No, not really." She said, "Well, get out." She said, we're still suffering from COVID here. It's only emergency and pain patients that we're seeing. So come back if you get pain." Oh, thank you very much. So then, on reflection, I thought, I think I have to go and get this done privately. There's a lot of work to be done, and I don't want to be going in and getting a tooth at a time done and sitting in queues. I'll be sitting in the hospital for months at a time, waiting to see a dentist. So I went to a town about, it's called Sriracha, about 30 odd miles away, I suppose. And they've got a well recommended hospital there. And I went there, and I thought, right, we can kill all the birds with one stone here. I can get all the teeth taken out, I can get the general anaesthetic, and all goes well. So I went down there, and I told them I was there just to get a dental plan and a costing for what I wanted doing, to make sure I could afford it. So a very nice lady dentist, and she took me in, and they got me x-rayed, and then they took 2 casts of the inside of my mouth, upper and lower, and then she sat down to talk me through what was required. I told her that I wanted a general anaesthetic, which was no problem. She said that would have to take place in the theatre, so they would have to do the extraction at the theatre, which means that they'd have to book a theatre. I'd have to have a surgeon, I would have to have an anaesthetist, and I'd have to have a dentist in attendance. The total cost of the treatment, everything that she was suggesting, was going to be about £7,000. Oh my God. 3,000 of that was just the extractions to be done under general anaesthetic in the theatre. Oh, so that visit and the examination, that cost me £120 for the x-ray and the castings that they took. So I took everything away, and I thought about it, and I thought, well, it's too much money, I'm going to have to shelve it, and when I go back to the UK I'll start getting treatment back there. Unfortunately, COVID's come along and I'm kind of stuck in Thailand, and there's no, if I go out to the UK, which I can, it will make it very difficult for me to return home here to my family. So to me it's a no-brainer. I have to stay in Thailand at this current time in this COVID pandemic. So once I found out I couldn't be seen by the government hospital, and the local clinic told me that they didn't want to do the job because they weren't sure about this tooth that was come later in life and may need surgery to take it out, I decided that I was going to go to try another clinic, which seemed a lot more upmarket. It was a bigger establishment, it had a good reputation. I'd done a lot of research on the various online organizations, Google, etc., to see what was recommended, and a lot of people recommended this clinic down near the beach in Pattaya. So I also done a lot of research on sedation, and it transpires that, okay, a general anaesthetic is good because it knocks you out, you don't know anything, but a lot of dentists, particularly in the UK, etc., if you need sedation, if you have anxiety, then they prescribe things like Valium, etc., that you can take the evening before, or an hour or two before you go in to have your teeth done, and it calms you down. And I was quite interested in that. I thought, okay. But then I looked up where I could get Valium, or diazepam as they call it now, or another one that was recommended that was slightly better was Xanax, which was supposed to be a little bit stronger, where I could get them in Thailand. Well, unfortunately, you can only get them from a doctor in the hospital after having a full examination, I guess. So that makes things a bit more difficult. Except when you sit in the bars here in Thailand, etc., you have a lot of these street traders come around, and they come up to the if you're sitting in the bar, they'll come up and they're trying to sell you watches or other items, cameras, blah blah blah, speaker systems. And there's also the people that come around with the little cases of boxes, including Viagra, Cialis, all these sexual enhancers. And I wondered if I'd heard that Valium was available on the street. So about 10 days ago I went downtown, and I saw one of these guys walking around, and I asked him what he had in the way of Xanax or diazepam. He said he had both, but he didn't have any Xanax with him at that time. But he did have diazepam, the Valium, and I bought 10 diazepam tablets from him. Strength that I could tell you another time. But those 10 tablets cost me 400 bahts, £10. He told me the Xanax was much more expensive, but if I wanted it, he could get me. And then I thought, okay, I'll go with the Valium first. Then I sat and had a couple of beers, and I thought, well, from what I read about the Xanax, it's supposed to be a bit stronger. And I also read, of course, that one of the problems with the Xanax is that if you take it on several occasions, it can become addictive, much like the opioids that are prescribed in America, etc. Now, it can become a problem and become addictive. So that puts me off a little bit. So, thinking about it more, I thought, right, just in case, I'm going to buy some Xanax too. So I rang this guy up who I just bought the diazepam from, and I said, can you bring me some Xanax? Which he did. He turned up about 20 minutes later with two strips of 10 tablets in each of Xanax, 1 milligram strengths, which is supposed to be quite good, and those 2 strips cost me 400 bahts, the same price, £10, despite him telling me that the Xanax was a lot more expensive. It actually turned out that they were cheaper because I got 2 strips of 10 instead of one load of 10 milligrams of one medication of the diazepam. Now, as I say, the strengths, I think the diazepams are a lot more than 1 milligram, but okay, I'll check on that and let you know in future. But now I've got Xanax and I've got the diazepam. And I thought, right, before I go to the dentist, I want to try them out. I've never taken these drugs before. So the day after I got them, obviously you can't drink alcohol or anything with these things, you're not supposed to anyway. I took a Valium tablet. Now, you say it relieves anxiety and calms you down, but when I'm sitting at home relaxing, I don't really actually have any anxiety or need any calming down. So it was very difficult to assess the effectiveness of it. Although I did feel at one stage as though I'd had a few drinks and I felt a little bit So I'm quite sure that was an effect from this diazepam. Then I left it a couple of days to let that go out my system, and then I tried one of the Xanax pills, and once again I couldn't establish whether it was calming me down or not. So I didn't even feel the sort of the alcohol type effect from the Xanax. So that's as far as the sedatives that I've got. And then I went to this clinic that had been recommended, and I went down there and they gave me a full check over. Now this is a beautiful establishment, well established, immaculately clean. They obviously have like consultant dentists that come in at different times of the day, probably come from the hospitals, etc., during the shifts. And I got an appointment last Wednesday in the morning, and the dentist come in, and I told him what I wanted. I wanted an upper set of dentures, and I wanted the teeth that were up there removed as painlessly as possible, and that was the objective for this visit. So once again we started with the x-ray, which I expected. They asked if it was okay to take an x-ray. It was going to cost 800 bahts, £20, etc. But yes, they needed to know what they're dealing with, so I agreed with that, no problem. And they took the x-ray, and then we sat down and he examined all my mouth, etc. And then he examined my bite and my teeth, etc. And then the problem came, the big problem came. When I was a young lad, I say young lad, when I was in my teens, mid-teens, I played a lot of rugby. And during one of those games, I actually broke my jaw on this side, which took several months of being wired up for it to heal. Well, it transpires that it's healed okay, but there has been a slight misalignment between the lower part of my mouth and the upper part of my mouth. Not a great deal, but significant enough that if you were wearing dentures or only one set of dentures on the top, it's not going to align with the teeth at the bottom. It's going to be very, very uncomfortable. Wow, that was really good news for me. So, what was the solution to this? Well, he pointed out that actually the solution is I'm going to have quite a lot of the lower teeth taken out at the same time. Not all, but at least 5, I think he said. And the 4 lower front teeth are the main ones that are misaligning, so they've all got to come out. And then they will make a denture for the front, which will be built to align with the upper part of my mouth. Oh dear, dear, dear. My heart was going lower and lower and lower. My stomach felt I wanted to be sick. This is terrible. Tragic news for somebody that detests dentists. But, okay, I then put it to him, look, I'm very afraid of dentists. How much pain is this going to really involve? And he's a nice guy. He wasn't young and he wasn't old. I'd say he's probably around his 40 mark. And he said to me, actually, he said, this day and age there is no pain. There is absolutely no pain except the small pricks that you get when you put the anaesthetic into your skull to dumb all the areas around where they're going to work. He said the modern drugs that they use completely numb it off. You don't feel anything. He said so pain is not a problem. He could guarantee it's pain-free. But he did say what is a big problem, not only with me, but with about 80% of patients he sees, he does see, is anxiety, exactly as we've been talking about, and sedation. He says people are afraid that they're going to feel the pain, and they get a lot of anxiety about it, and that is where the problem is. And it's getting over people's anxiety that makes the whole job easier. And to that end, the first start was that they make the places very nice, very clean, very well decorated, even some soft music in the waiting rooms, etc., to try and calm people down. And it all becomes a bit obvious then. So in the discussions I told him, well, I have heard, I've said to him in the UK, I've heard that the dentists can give their patients some sedation, like Valium or Xanax, etc., and that helps the anxiety level too. And he said yes, he knows about that, and unfortunately he can't prescribe that. If I wanted that, then I would have to go and see the hospital and get the tablets from them, and then I could come back. So I told him, well, I already have some tablets actually. I said, would he mind if I took a couple of Valium tablets before I have the dental work carried out? I said, no problem. He said he would only do it if, and he would insist on that after the surgery, because I had taken these sedatives, that someone pick me up and back in a car or whatever, and take me home and stays with me for an hour or two until everything wears off. Well, that's not a problem that can be done. So after that examination and the discussion with the guy, actually I felt a lot more positive about what was going to happen. And then the next thing is we discussed the cost of things, and he went through it all, what I would need, and the cost of the extractions, and then the cost of this bottom plate, and then when he said that after they've taken the bottom teeth out, he suggested that they wait 2 weeks or so with nothing in there, just to let that heal a bit naturally, and then they would have a plate to put in the bottom. Once that plate was in and we were happy with that, then they would start work on the upper part of my mouth and extract all the teeth up there. Good. So he said that when they did that extraction of all the teeth in the top, he would already have an upper set of dentures produced, ready to put in immediately. He said obviously there'd be holes there and where in my gums where the teeth had just come out, but he would put some soft type of cap around there to protect them, and I'd still be able to have these dentures placed in my mouth. And that would have to remain the case for about 2 months, and I'd have to let them heal naturally and just take it easy while the mouth healed. And then after about 2 months, when everything had gone firm and set, then I would go back in and you take this soft lining out and replace it with a hard lining that would set the dentures in for proper use over the years. He said at that time also, if I so wished, it would be possible then to start contemplating having the implants put in. Well, I think like the UK, it's the same in Thailand. Implants are very expensive. I think they start around £1,000 each. I'm 71 years old, so I don't intend to go down that route. I just don't see the value, the long-term value in spending that money now. So that's where I am. So today is Monday, and tomorrow, Tuesday at 11 o'clock, I'm going down to have one bottom tooth taken out. Now, he has suggested, the dentist suggested this, he said it will give me a big confidence factor. He said, take your anxiety tablets, he said, come down, we'll take one tooth out of the bottom, which has got to come out, and then leave that, because he wants that out of the way anyway, to take another lower cast of the mouth for the lower dental plate. So he'll take that tooth out first, and he said it would be an example of how pain-free the procedure can be. I'm not saying I'm looking forward to it, but I'm not so worried about going down there. We've got to give it a try. I know the whole job's got to be done. I've got a large hole in one of my upper teeth. It can't be filled. It's a root canal job. And because the tooth is already a little bit loose, it'd be a waste of money doing the root canal treatment. We've got to go for the denture route. It's ironic, this injury that I got from the rugby many years ago, and it was his opinion, is the reason that I've lost so many of my teeth. Obviously, I have not taken as good a care of my teeth as I could have done, but the fact that there has been misalignment of the jaws is as you take one tooth out, the tooth next to it loses its part of its support. It starts coming loose, and with the reduced gum effectiveness, then eventually they're all going to work loose, and it'll be a case of one, and then another few months later, another one. So it's all got to come out at some stage. So it's a case of biting the bullet now, and biting the bullet, if only. Anyway, that's the story today. I hope you understand why I've issued this. I want to give some people confidence and some thoughts about if they should need dental treatment, particularly here in Thailand, or anywhere in the world actually, what the problems are and what the solutions may be. And I will follow this up, and I'll let you know how I get on tomorrow with the extraction tomorrow, and I will keep you updated on the treatment. If you want to know, then please subscribe and let me know, and like this video. Let me know how you get on, and ring that bell so you know when I've put the next video up. And thank you for watching. And finally, during this terrible time with this pandemic, please, everybody stay safe. Thank you.